Hello, we're St. Louis University nursing, physical therapy, and occupational therapy students working with Ujama. We're going to discuss mental health and COVID-19, but we're going to start by introducing ourselves. So my name is Alexis. I'm a nursing student.
I'm Madeline, and I'm also a nursing student.
I'm Ivy, and I'm also a nursing student.
I'm Grace, and I'm a physical therapy student.
I'm Naomi, and I'm also a physical therapy student.
I'm Erin, and I'm an occupational therapy student.
And I'm Juliana, and I'm also an occupational therapy student.
So part of our project is about mental health and COVID, and we wanted to provide more information on mental health and also what signs and symptoms that we should be aware of. So mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It can help determine how we handle stress, relate to others, and make healthy choices. Signs and symptoms of mental health include feeling helpless or hopeless, having low or no energy, eating too much or too little, sleeping too much or too little, hearing voices, thinking of harming yourself or others, difficulty performing daily tasks like getting ready, severe mood swings that are causing problems with others. You can have one or more of these symptoms. And the benefits of having positive mental health is that it increases your ability to cope with the stresses in life. It increases your work productivity. It improves your self-confidence, it improves your mood, and it increases your ability to have good relationships with others.
So one of the first things that our group did regarding this project was conduct some research. And the first article that we looked at was a survey conducted by the Indian Journal of Psychiatry concerning mental health. And they found that of the over 150 participants, many of them were either depressed or experiencing anxiety and stress. And there were many predictors for declining mental health, which includes experience in the health sector, duty hours, use of protective equipment, and then coping strategies. And then in another article that we looked at, they had conducted studies of many different respondents and found that 54% of them rated the psychological impact of COVID-19 as either moderate or severe, and the rest of them rated it as also moderate and experiencing a lot of anxiety. So there were many factors, psychological factors, that played an important role in adherence to public health measures, including vaccination and in how people cope, just emphasizing the importance of coping strategies and seeking help, and then also getting vaccination. People that had pre-existing mental health and then substance use disorders were at an increased risk of infection, problems accessing testing and treatment, and then also an increased risk of negative physical and psychological effects.
So we also looked at another study. It was showing the average amount of adults reporting symptoms of anxiety or depression in January through June of 2019, and then January of 2021 after the pandemic. So as you can see here in the graph, the results were exponentially higher for how many people were experiencing anxiety and depression during COVID. So all this data is just to say that if you're experiencing any of the signs and symptoms discussed previously, you're not alone, and there's stuff that you can do to help cope, and we'll talk about that in the coming slides.
So some tips for coping with the pandemic as an adult, really just going back to the basics, like having a healthy diet, exercising regularly, and getting enough sleep. Just try and keep things that you can control as consistent as possible. So you really want to address the stress. So just taking it in, noticing it, just practicing intentional stress reduction techniques such as mindfulness, meditation, and exercise, and try to set limits for yourselves with your family and news consumption. And problem-based coping is very helpful when you need to change your situation. So some coping skills that you can do for that is just working on time management, maybe asking for support, having healthy boundaries, and creating a to-do list. And then emotion-based coping is helpful when you need to take care of your feelings because the situation is out of your control. And some coping skills for that would be exercise, maybe taking a bath, giving yourself a pep talk, or maybe just meditating.
So, some tips for coping with the pandemic as a parent: ask your child how they're doing. They may have questions or concerns about what is going on, and helping them to feel comfortable and safe will help them improve in other areas of their life, such as school. So, some practical ways to support your child: you want to focus on emotional well being over everything else. Check in frequently and update them on changes. Go back to the basics. So, like we've said, eating a healthy diet, exercising, getting enough sleep, and having some structure in the routine is important. And then finding the positives.
More tips for coping with the pandemic as a parent is supporting your young kids. Notice they may have more meltdowns and start to go backwards in things they've already learned. So, some ways you could help reduce this is schedule intentional one on one time with each child. And this could look like playing a game, coloring, talking about their feelings, having a dance party, or writing a letter to a friend. Other activities to keep your child active are reading in daily journals or going for walks, going to the park, playing sports, or riding a bike. And then support for teenagers. Teenagers may be experiencing a sense of loss and grief at missing out on important things. So, some ways to help them is to be present and be available when they're ready to talk. Good times to talk are in the car while watching sports or while playing a game. Encourage them to continue to connect with their friends safely. Make sure that they're still practicing all the guidelines, such as wearing a mask when in person and gathering outside. And then also they could connect electronically through FaceTime. And then here's an extra list of coping skills. And some of the examples are, again, journaling or writing a letter, taking a walk outside, eating something healthy, trying something new. And there's just a whole bunch of examples for you.
We also wanted to make sure to give some warning signs. So these are some warning signs of mental health crises. So if you're feeling yourself pulling away from your loved ones and usually favored activities, if you feel that you have low or no energy, if you're feeling numb or like nothing even matters anymore, if you have any unexplained aches or pains on your body, if you are smoking, drinking, or using drugs more than usual, if you're feeling more confused, forgetful, or on edge, if you're thinking of harming yourself or others, or if you have an inability to perform daily tasks like taking care of yourself or your kids, please seek help.
And then to close off this video, we just wanted to provide some resources that could be available to you in the St. Louis area. So we have Crises Counseling in Response to COVID-19, Adaptive Missouri, Annie Malone Children and Family Center, Avenues Counseling, and hotlines that like the Suicide Prevention Line and the Distress Helpline.
That concludes our presentation. Thanks for listening.